Hi, this is Angie Steinow. Today I'm going to be talking about Clarity Child Guidance Center, which is located in San Antonio, Texas. Clarity is a treatment center that is a nonprofit which helps children who have a mental health diagnosis. Clarity offers therapy and psychiatric evaluations for children. Clarity allows children and families to receive mental health care. Clarity offers parenting classes to help teach parents how to parent children with mental health issues. Clarity offers outpatient services. They offer acute care. There is a 24-hour on-campus treatment center. There is an on-campus day treatment center. And there's a clinic. So there are some residents with severe mental health diagnosis that do reside on campus at the treatment center. When a parent needs help, what symptoms to look for or what type of behaviors to look for? When a child is exhibiting unsettling behaviors, perhaps their behaviors have changed, maybe they're a quiet, sweet child who is now loud, abrupt, rude, doesn't listen, is talking back, which is something that is out of character and not appropriate for their age, depending on the child. The child remains sad or disturbed for a significant amount of time. Child's grades and school performances are dropping. Perhaps there have been parent-child conferences and the teacher is stating their concerns with grades dropping, slipping, they're becoming not involved or participating in the class, and they're concerned with their behavior. The child has anger, depression, or anxiety. There is changes in the child's diet or sleep. Perhaps they're coming home from school and napping. They're no longer engaging in certain sports or after-school activities or any hobbies. The child appears suicidal, again, being very depressed. Maybe you've heard the child discuss suicidal thoughts or asking about suicide to a friend. This behavior is very concerning and someone should seek help immediately. A child is harming or is harmful to others, perhaps maybe hitting a sibling, wanting to hurt a sibling, when you realize that play is no longer play and the child is seriously wanting to hurt another individual. The child begins to harm or hurt animals. Maybe he starts throwing them up in the air. Some children have been walking dogs and are pulling them very hardly at their leash, wanting to choke the animal. This is a concerning behavior. When the child begins to use alcohol or drugs, this is also a very significant and unsettling behavior. Clarity treats children in their own special way. There's not a whole lot of treatment centers that are just primarily focused on treating children with mental health illnesses and diagnosis. Each child and family is treated with respect and decency. Clarity is a peaceful and safe facility and does not have the feel of a hospital. And don't let the thought of any financial burdens deter you from getting help for your child. Clarity accepts various insurance and offers payment plans. Clarity encourages family involvement during a child's treatment, whether it be inpatient or outpatient. If the child is residing inpatient, they do recommend family visits in the evenings and on weekends. Clarity Guidance Center formulates a treatment plan unique to the child and to their family. The plan helps children and families conquer the mental illness, allowing the family and child to mesh with society in their school or in their home. A primary care physician makes a referral for mental health care. A child and their family have gone to see their regular primary care doctor, and that doctor makes a mental health diagnosis and refers them to counseling, and maybe that counseling or therapist will have a mental health diagnosis and they recommend treatment at some place such as Clarity. The child and family seek counseling and therapy. There's often many different types of group therapies. Clarity recommends group therapy for children perhaps that are depressed or anxious, feeling suicidal, and they also recommend individual counseling and family counseling. So the parents can be present during the counseling sessions. It's recommended that the parents read articles and utilize resources to understand the child's mental illness. Key to understanding that mental illness is beneficial and extremely important to getting the child the help that they need when they're diagnosed, when they're getting treatment, and in long term. Don't be afraid or hesitant to ask for help. This is extremely important too. Some people are embarrassed because their child is acting out a certain way. They just think there's nothing wrong. But any type of behaviors that I have mentioned need to be looked at and perhaps treated. There are many job opportunities at Clarity. There's medical doctors, there's nurses, there's human resource staff, there's clinicians, which is what I am interested in becoming with my master's degree in social work. And to work at a facility such as Clarity, a license is required in social work. I think Clarity is a great facility for helping children and families with mental health diagnosis and illnesses. There's not a lot of these types of facilities in my area, and it's extremely important for children and families to get the help that they need and to seek treatment with a mental health diagnosis. Thank you.